Welcome to the 2017 American Academy of Nursing Induction Ceremony. To begin tonight's ceremony, please welcome the President of the Academy, Bobby Berkowitz, and President-elect, Karen Cox.
Good evening, ladies and gentlemen, and welcome to the American Academy of Nursing's 2017 Induction Ceremony and Celebration. I'm Bobby Berkowitz, and it is my great honor to serve as the Academy's president, and today I'm joined by Karen Cox, the Academy's president-elect. Now, Karen and I are very pleased to host this evening's event. Now, nursing is a profession that is increasingly more important to healthcare worldwide, and our induction serves as a celebration of our profession. We honor a group of professionals whose achievements are distinguished, influential, and transform health policy and practice. Let's begin our evening celebration by recognizing this year's living legends. Within the Academy, we recognize a select group of fellows whose lifetime accomplishments are so distinguished as to render them legends in their own time, living legends. On Thursday evening, I had the honor of announcing the 2017 Living Legends. If you please, I ask that each of the living legends stand when I call your names. Linda Cronenwet. Elaine Larson. Carolyn Williams. Nancy Fugate Woods. And Connie Yarbo. Before we begin tonight's induction ceremony, it is my great honor to introduce the 2017 Civitas Award recipient. The Civitas Award is bestowed on an individual who exemplifies extraordinary dedication in promoting high-quality nursing care, and this evening it is my privilege to honor Academy Fellow, Deputy Surgeon General Rear Admiral Sylvia Trent Adams. I have a few things to say about this remarkable woman. Throughout her career, Rear Admiral Trent Adams has been an outspoken advocate for public health, particularly for poor and underserved communities. A 24-year veteran of the U.S. Public Health Service Commission Corps, she served as the agency's chief nurse officer from 2013 until 2016, advising the department on the recruitment, assignment, and deployment and retention of nurse professionals. In her role as Deputy Surgeon General, she advises and supports the Surgeon General regarding the operations of USPHS and in communicating the best available scientific information to advance the health of the nation. Prior to joining the Office of the Surgeon General, Rear Admiral Sylvia Trent Adams was the Deputy Associate Administrator for the HIV/AIDS Bureau at HRSA, where she assisted in managing the Ryan White HIV/AIDS Treatment Extension Act of 2008. The $2.3 billion program funds medical care, treatment, referrals, and support services for uninsured and underserved people living with HIV disease, as well as training for healthcare professionals. Once a 20-year-old candy striper, volunteering on Saturdays at Lynchburg General Hospital in Virginia, Rear Admiral Trent Adams is now an influential voice for the nursing profession in public policy arena. In her public addresses across the country, she has repeatedly stated that nurses are the powerful force that can change healthcare delivery and has urged new nursing graduates to play active roles in public health issues. The Academy applauds your inspirational work, your remarkable influence, and your selfless commitment to building systems of care to improve public health for marginalized populations internationally. We are very proud to have you as a fellow in the Academy. I can think of no one more deserving of this award. Thank you. At this time, I would like to recognize the extraordinary leadership the Academy has been fortunate to have over the past 43 years. That leadership has come not only from the people serving on the board of directors, but from all of our fellows who have unselfishly given their time and talents to advocate for the promoting the health of individuals, families, and communities. First, our charter members. The first cohort of fellows have guided the Academy since its beginnings in 1973, 44 years ago. We also have a number of our past presidents in the room, people who assumed the ultimate responsibility for driving the Academy and nursing to new heights during their tenures. I want to ask all of our charter members to stand and receive an expression of our thanks for your service and commitment. Thank you for your leadership. Before we recognize our new 2017 class of Academy Fellows, please join me in thanking the members of the Academy's Fellow Selection Committee, led this year by Joan Shinkus-Clark, Judy Beal, and Ann Gross. The Selection Committee reviewed 270 applications, selected 171 new fellows who you will meet this evening. Will members of the Fellow Selection Committee please stand? So in order to move through our induction in an efficient way, we ask that you limit your applause, not completely, not completely, but this is because this is a very important event in their lives, but limit it and refrain from greeting the fellows during the ceremony. There'll be plenty of time for that afterwards. We'll be introducing the fellows in groups according to their country or state, and weaving in the introduction of our honorary fellows as well. So, our first fellow to be inducted tonight joins us from the state of Alabama, Comfort Chu Inna. Dr. Inna's research focuses on reducing preventable health risks of vulnerable adolescent populations. Her research on responsive, innovative interventions for underserved populations has influenced the work of nurses and other health professionals in the U.S. and globally. Congratulations and welcome to the Academy. From the state of Arizona, Jane Carrington. Dr. Carrington has explored nurse-to-nurse communication using the electronic health record and change of shift handoff. The goal of her research is to reframe the electronic health record from that of a documentation system to a communication system. Welcome to the Academy. Mary Jo Jurdy. Mary Jo Jurdy has led strategic initiatives that expand clinician capability, enable consumer-focused care, empower practice and advocacy, and engage the clinician community. Her blend of business, clinical expertise, and leadership has resulted in delivering transformational programs. Welcome to the Academy. Kate Shepard. Dr. Shepard is an educator, and family nurse practitioner whose interventions have significantly improved access to emergency and mental health care. And her compassion fatigue intervention is being replicated by nurse scientists nationally and internationally. Welcome to the Academy. From the state of Arkansas, Sarah Jane Rhodes. Dr. Rhodes has a passion for improving maternal and neonatal outcomes in rural areas. Her research focuses on the effective use of connected health technology to improve patient outcomes, provider experiences, as well as patient and family-centered care. Welcome to the Academy. Baophone Tsai. Dr. Tsai has developed nursing theories that enable the identification of pain behaviors and promote technology to care for elders with dementia. Her research provides an evidence base for the Tai Chi program adopted by the Arthritis Foundation and used by many senior centers nationwide. Welcome to the Academy. Marlene Walden. Dr. Walden's expertise in neonatal pain has been influential in establishing guidelines used in the US and globally. She is co-editor of 2 AJN Books of the Year, Core Curriculum for Neonatal Intensive Care Nursing, and Grant Writing Handbook for Nurses. Welcome to the Academy.
From the country of Australia, Wendy Shaboyer. Dr. Shaboyer's research has focused on contributions acute care nurses can make in the areas of adverse events, clinical handover, and the ICU discharge process. More recently, she has conducted research in the area of patient participation. Her work has resulted in the adoption of the liaison nurse role in many countries. Welcome to the Academy. Sandy Middleton. Sandy Middleton is Professor of Nursing and Director of the Nursing Research Institute, St. Vincent's Health, Australia, and Australian Catholic University. She was the lead investigator of a landmark stroke trial demonstrating nurse-initiated, evidence-based interventions decreasing 90-day death and dependency that has influenced policy and practice internationally. Welcome to the Academy. From the country of Belgium, Walter Surmis. Dr. Surmis is professor at the KU Leuven Institute for Healthcare Policy, University of Leuven, Belgium. He is the head of the WHO Collaborating Center on Human Resources for Health Research and Policy. His research is focused on the relationship of nurse staffing on quality of care. He was the European coordinator of Nurse Forecast, one of Europe's biggest nurse workforce studies. Welcome to the Academy. From the country of Brazil, Amardi Fatima Marin. Dr. Marin was instrumental to influence nursing informatics in Brazil. Her mentoring and leadership influenced nurses and other health professionals in Brazil and globally to develop and implement information technology and communication to improve citizen health status. She is the first nurse to serve as editor of the International Journal of Medical Informatics. Welcome to the Academy. From the state of California, Linda Abramovitz. Linda Abramovitz is a pediatric oncology bone marrow transplant clinical nurse specialist and has worked at the University of California, San Francisco for over 32 years. She has utilized her expertise to support nurses in low and middle income countries to improve the care for children with cancer and promote the specialty of pediatric oncology transplant nursing. Welcome to the Academy. Mary Sue V. Heileman. Dr. Heileman focuses on improving the accuracy of media portrayals of nursing. She has pioneered the use of transmedia storytelling to enhance mental health symptom management among Latinas. Qualitative research informed the creation of her transmedia intervention featuring a nurse character. Welcome to the Academy. Jan M. Nick. Dr. Nick specializes in strengthening nursing academic units globally, particularly those in low-resource countries, by teaching them evidence-based principles and helping them access new avenues for scholarly information. Her research focuses on validating an objective EBP measure into different languages so countries can document baseline knowledge. Welcome to the Academy. Sylvain Trepanier. Dr. Trepanier is the Chief Nurse Executive for Providence St. Joseph Health, Los Angeles and California region. He is a pioneer in work on population health management strategies and a cost-benefit analysis model supporting residency programs for new nurses. Welcome to the Academy. Cheryl Westlake. Dr. Westlake's research addresses outcome determinants and interventions to improve heart transplant and heart failure patient care. She contributed to national and international association guidelines, writing, and was a Fulbright Scholar to Ecuador studying heart failure, risk reduction in the rural poor, and contributing to nursing advancement. Welcome to the Academy. Eric J. Williams. Dr. Williams, president of the National Black Nurses Association, championed a violence reduction program utilizing strategies to build community resilience, collaboration, legislation, and safety. Rooted in social justice and health policy, he mobilized nurses to increase awareness of violence as a public health crisis. He was featured in a CNN segment called A Nursing Professor Rejoices. Welcome to the Academy. From the country of Canada, Josephine Ottawa. Dr. Ottawa's research uses social justice and a critical theory lens to address inequities in health and healthcare with a particular focus on the health of African Canadians and building capacity for nursing research in low and middle income countries. She has led Canadian Institute of Health Research funded studies resulting in practice and policy changes in this field. Welcome to the Academy. Edith M. Hyland. Dr. Hyland's current research examines the health of women and children from a global perspective and is focused on improving access to high-quality health care for mothers and newborns in rural and remote settings through the use of new technologies. These technologies provide for low-cost emergency obstetric care and support preterm, low birth weight babies. Welcome to the Academy.
Thank you.
Kathleen McMillan. Dr. McMillan's career spans all 5 domains of nursing, with a focus on nursing education and policy in Canada. Her leadership activities and policy work influence baccalaureate education as entry to practice and strengthen nursing education and practice. Welcome to the Academy. Ann W. Snowden. Dr. Snowden is a professor at the Odette School of Business and chair of the World Health Innovation Network, and the scientific director and CEO of SCAN Health, a global network to advance patient safety and health system sustainability. She is also a Fulbright Scholar. Welcome to the Academy. Jennifer Stinson. Dr. Stinson is a senior nurse scientist and nurse practitioner with Sick Kids, a hospital in Toronto. Her research focuses on promoting chronic disease self-management in children and youth using digital health technologies. She has led Canadian Institute of Health Research and National Institutes of Health funded studies of chronic disease self-management interventions that are now freely available to educate patients and families. Welcome to the Academy.
From the state of Colorado, Cynthia Oster. Dr. Oster overlaps high reliability principles with evidence-based practice to achieve multidimensional clinical quality and exceptionally safe patient care. Her framework, grounded in evidence for approaching nursing care processes, yields effective patient and cost-saving outcomes and quantifies nursing value. Welcome to the Academy. Shannon Sables Vows. Dr. Sables Vows is a practicing clinician, researcher, and academician. She's combined her expertise in infant neurodevelopment and patient safety to influence nurses and other health professionals in the U.S. and globally. Welcome to the Academy. Carolyn Sipes. Dr. Sipes, a pioneer in HIV/AIDS research, has considerable expertise in leadership, research, innovative teaching, and project management within the healthcare industry. She has overseen and implemented electronic health record systems that inform her teaching methods and impact nursing. Welcome to the Academy. Sharon Van Wicklen. Sharon Van Wicklen has authored 7 guidelines for perioperative practice. These guidelines are recognized as the authoritative source for perioperative practice, both nationally and internationally. She continues to educate, mentor, and support those entering the nursing profession and furthering their education. Welcome to the Academy. From the state of Connecticut, Linda F. Honan. Dr. Honan is dedicated to developing effective and innovative techniques for clinical education in a multidisciplinary environment. Her research reveals that diagnostic observations are significantly improved by visual examination, training with works of art. Welcome to the Academy. Denise Susan Walsh. Dr. Walsh has taken her expertise in nursing administration internationally, working with the Bill Clinton Foundation in Liberia and Ethiopia. She brings a global perspective of healthcare to the classroom in an academic program designed for the future of global health. Welcome to the Academy. Each year, the Academy's board receives nominations for honorary fellowship. These fellows are professionals who've made outstanding contributions to nursing and healthcare, but would not qualify for membership as fellows because they're not nurses. This year, the board has selected 3 individuals for this honor. Our first honoree is Dr. Joe Ivey Beauford. Ivey Beauford is immediate past president of the New York Academy of Medicine and Professor Emeritus of Public Service, Health Policy and Management at the Robert F. Wagner Graduate School of Public Service. She is also a clinical professor of pediatrics at the New York University School of Medicine. In the 1990s, Dr. Beauford served as the Principal Deputy Assistant Secretary for Health in the U.S. Department of Health and Human Services. She also served as the U.S. representative on the executive board of the World Health Organization. Dr. Beauford is a distinguished scholar, public health policy leader, and pioneering clinician in the care of children with a special focus on population health. She has worked tirelessly to assure that nursing, medicine, and public health address the social determinants of health for older adults and urban populations. As the leader of the New York Academy of Medicine's Urban Aging Initiative for New York City, Dr. Beauford persisted in establishing New York as an age-friendly city. Her efforts led to a robust change in city health policy for naturally occurring retirement communities, a public health program outreach for older adults, and home visiting services by nurses and other caregivers. Dr. Beauford has been a strong advocate for the vital role of nurses in improving health care. During her tenure as president of the New York Academy of Medicine, she not only increased the membership of all health disciplines in its governance structures, but established a new nursing section and advocated for bringing nurses onto the board of the New York Academy of Medicine. In her work advising funders, such as the Doris Duke Foundation, she has been able to showcase the contribution of nurses to improving health systems around the world. We welcome Dr. Ivey Beauford into the Academy as an honorary fellow. Welcome to the Academy.
From the country of Denmark, Charlotte Delmar. Dr. Delmar's contribution to nursing is her leadership and research leading to the construction of the Scandinavian ethical demand model, the theory of existential life phenomena, in caring ethics, bridging the gap between theory and practice. She has experiences from leading positions in university hospitals and professorships at universities in Denmark and Norway. Welcome to the Academy. From the District of Columbia, Laden Escovari. Dr. Escovari is a nurse, anesthetist, and a physiologist. She has been on the faculty at Georgetown University for 20 years and is the director of the Doctor of Nurse Anesthesia Practice program. She is an expert in pain and stress physiology. Her research identifies physiologic markers of chronic pain modulated by acupuncture. Welcome to the Academy. Karen Swisher Keste. Dr. Keste provided national leadership in establishing policy and setting standards for education, certification, and regulation of advanced practice nursing. Her work shaped the educational preparation and influenced the scope of practice of advanced practice nurses across the nation. Welcome to the Academy. From the state of Florida, Jean Louise Hannon. Dr. Hannon's research addresses overcoming health disparities of minority women and children. With over 25 years as an advanced practice nurse, she has the commitment in achieving health for all and has built her program of research from her clinical expertise and strong community linkages. Welcome to the Academy. Ying Mei Kung. Dr. Kung's passion for policy and political advocacy has led to improved access to quality health care. She has dedicated her teaching, service, and scholarship efforts to update laws and regulations to expand the scope of practice for advanced practice nurses. Welcome to the Academy. Kim Layton. Dr. Layton spearheaded development of standards of best practice for simulation, leading to widespread dissemination of best practices to an interprofessional audience worldwide. Her research focuses on development and psychometric analysis of evaluation tools to support comprehensive simulation program evaluation. Welcome to the Academy. Denise Mcguire. Dr. Mcguire's research has provided a measure of irritability of infants with neonatal abstinence syndrome, their unclear cues, and decreased responsiveness to their mothers. She has tested a simple NICU intervention to improve mother-baby interactions between mothers and their infants. She was the first to report that neonatal intensive care nurses were not familiar with evidence that guides drug addiction treatment. Welcome to the Academy. Susan Marie Perry. Dr. Perry combined practice, education, and policy to expand scope of practice for certified registered nurses in the U.S. and globally through military and humanitarian outreach. In her 25-year military career, retiring as colonel, she led the implementation of EBP and expanded military nursing research opportunities. Welcome to the Academy. Jonelle Potter. Dr. Potter's primary area of impact is the design of innovative nurse-based models of care for vulnerable populations, providing care and treatment to address the unique medical and psychosocial needs of women throughout their lifespan. In the early 1980s, when the HIV epidemic emerged, she participated in the seminal clinical trial demonstrating that HIV transmission from mother to child could be prevented. Welcome to the Academy. Michelle Upvall. Dr. Upvall is a leader in global nursing and an academician. She has developed innovative nursing programs leading to the professional transformation of nurses across the globe and promoted capacity building and sustainability through global nursing partnerships. She is a Fulbright Scholar. Welcome to the Academy. From the state of Georgia, Elizabeth A. Downs. Dr. Downs has dedicated her career to advancing nursing capacity and competency around the world through high-quality education for nurses and educators and the development of advanced practice nursing workforces capable of responding to the needs of their communities. She is an international consultant to the Carter Center. Welcome to the Academy. Dorothy Jordan. Dr. Jordan's nursing career has centered on the health and well-being of children and adolescents. Her work's impact is evident in the profound, life-changing experiences that thousands of children and families and volunteers have had over 35 years at Camp Sunshine. Welcome to the Academy. Lisa Marie Thompson. Dr. Thompson's research focuses on global environmental health disparities. She uses an implementation science approach to design behavioral interventions that reduce women's and children's exposure to household air pollution in low-income countries. She has received funding from USAID, NIH, and Grand Challenges Canada. Welcome to the Academy. Barbara Tom Cech. Dr. Tom Cech serves as senior scientist at the CDC. She has documented the magnitude of maternal and neonatal mortality and morbidity and sexual violence among populations affected by humanitarian emergencies. Her work influenced the minimum standards of reproductive health care among women in humanitarian settings. Welcome to the Academy. Sharon Van Arsdale. Ms. Van Arsdale is an advanced practice nurse focused on developing protocols and improving the readiness of healthcare workers and facilities across the country to safely care for patients with highly infectious diseases. As Program Director for Serious Communicable Disease Unit at Emory Hospital, she's also been involved in the care of people with the Ebola virus. Welcome to the Academy.
From the country of Hong Kong, Saying Chair. Dr. Chair's research generated evidence to change nursing practice and to improve perioperative care of cardiac catheterization. She has used multimedia interventions through websites and mobile apps to maximize knowledge transfer for public education and empowerment. Welcome to the Academy. From the country of Iceland, Helga Jonsdottir. Dr. Jonsdottir has been instrumental in developing expert nursing practice for chronically ill adults and their families, particularly pulmonary and neurological patients, with countrywide impact within outpatient and inpatient facilities in Iceland. Welcome to the Academy. From the state of Illinois, Susan Breitenstein. Dr. Breitenstein's scholarship addresses the implementation of evidence-based interventions in primary care. Her research has made significant contributions to improving the quality, accessibility, sustainability of evidence-based programs that strengthen parenting and reduce child behavior problems. Welcome to the Academy. Lola A. Koch. Dr. Koch is a cardiovascular clinical nurse specialist who is an expert in cardiovascular lifestyle behavior change and risk reduction strategies using motivational interviewing. She also developed the Healthy Heart Program for underserved women. Welcome to the Academy. Lorna Finnegan. Dr. Finnegan integrated big data analytics, academic practice partnerships, and national leadership to improve primary care for vulnerable and underserved populations. Her research, theoretical framework, and practice guide development of innovative primary care models to address multiple determinants of health. Welcome to the Academy. Thank you very much. Catherine Taylor Foster. Dr. Foster's military career has helped create a pathway for equal opportunities for women, including the development of incentives to recruit and train nurses in the military. She is a retired colonel in the U.S. Army Corps, U.S. Army Reserve, and serves with international and military organizations to improve global and veterans' health. Welcome to the Academy. Barbara Holmes Goebel. Barbara Holmes Goebel's expertise in cancer and palliative care have influenced nurses and other healthcare professionals in the U.S. and globally. Her numerous publications and presentations address symptom management that are pertinent to the care of patients and their families with the diagnosis of cancer. Welcome to the Academy. Beth Marks. Dr. Marks' research develops and tests health promotion interventions for people with disabilities. These interventions are used by state and community organizations to create health promotion policies and programs. Welcome to the Academy. Catherine Ryan. Dr. Ryan has bridged academia and practice environments by creating innovative programs, accelerating translation of research into practice, as well as introducing new methodologies to study and understand cardiovascular symptoms. Welcome to the Academy. From the state of Indiana, Carol Elizabeth Bonham. Carol Bonham, an award-winning educator, author, and community leader, is passionate about advocating for children's mental health. She has developed and implemented community-based programs that provide mental health services for children, adolescents, and families. Welcome to the Academy. Linda K. Chase. Dr. Chase has contributed to the body of knowledge regarding nurse manager competencies and the impact on unit-level practice and patient outcomes. Her influence on nurse manager competencies has contributed to improving interprofessional collaborative practice. Welcome to the Academy. Catherine Ivory. Dr. Ivory is a thought leader in healthcare and a nurse scientist whose innovative leadership influences nursing practice and professionalism that demonstrate and evaluate nursing processes and illustrate nursing's contribution to outcomes. Welcome to the Academy. Ukamaka Marian Oruche. Dr. Oruche's commitment to addressing the mental health needs of underserved populations has led to the development of interventions to improve the mental health of caregivers of adolescents with disruptive behaviors. She leads an international initiative to enhance healthcare delivery in southern Nigeria. Welcome to the Academy. Carol Shea. Dr. Shea's research addresses health literacy, information disparities, and interventions to strengthen the information-behavior link among pregnant women. Her work has shaped evidence-based health information design and innovative strategies to maximize the effect of health information on health behavior change. Welcome to the Academy. From the state of Iowa, Judy Verger. Dr. Verger's scholarship in nutrition for critically ill children has helped to establish the role of pediatric nurse practitioners in acute care. Welcome to the Academy.
From the country of Italy, Gennaro Rocco. Dr. Rocco is the director of the Center of Excellence for Nursing Scholarship. The center, one of the first to be instituted in Europe, has fostered and received funding for more than 80 nursing research projects in the last 9 years, sparking multiple peer-reviewed publications at the national and international level. Dr. Rocco also founded the first national regulatory body for nursing in Albania. Welcome to the Academy. From the state of Kentucky, Dorothy Brockop. Dr. Brockop's research addresses acute and cancer pain among adults, examining the negative influence of bias when nursing are treating patients' pain. She has published a text on nursing research and is developing another program for hospital-based research that highlights clinical nurses. Welcome to the Academy. Sheila Drake Melander. Dr. Melander has worked to increase clarity around scope of practice issues, as well as provided guidance for curricular and competency development for APRNs. She is a leader in innovative partnerships between academia and healthcare providers. She recently completed a 2-year term as the president of the National Organization of Nurse Practitioner Faculties. Welcome to the Academy. Now we have our second honorary fellow this year, and that is Winifred Y. Carson Smith. Winifred Carson Smith is a staunch advocate for nursing and a tireless defender of the rights of nurses to practice at the top of their education and license. For 30 years, attorney Carson Smith has authored, proposed statutory language, testified in federal hearings, and advised nursing organizations on strategies to remove unnecessary regulatory barriers to nursing practice. Her contributions are responsible for advancing the antitrust conditions that discriminated against advanced practice nurses. Early in her career, Ms. Carson Smith authored the District of Columbia's Advanced Practice Law, inserting a provision to address anti-competitive conduct in the credentialing process. After joining the American Nurses Association staff, she frequently assisted states in drafting practice legislation and advised AAN and others on federal legislation, as well as a vast array of issues affecting clinical practice and regulation. She wrote and presented testimony to government bodies, including the Federal Trade Commission and the Department of Justice, to prevent unnecessary regulations from impeding advanced practice. She has been a strong voice for nurse prescriptive authority and led a grassroots campaign under the ANA umbrella for consistency in advanced practice prescribing. As part of this effort, she wrote comments for nurses to use in communicating with the DEA and others to ensure that the effort had a strong, unified message. As threats continue to curtail practice in many states, Winifred Carson Smith has engaged social media as a major tool to reach and advise them on actions that can be taken to allow APRNs full practice authority. With an active Facebook following of her work and podcasts, APRNs continue to enjoy access to essential information. Her work continues to help liberate APRNs to improve access to quality, affordable care, particularly primary care, a major goal of health care in our country. We welcome Winifred Carson Smith into the Academy as an honorary fellow. From the country of Lebanon, Myrna Abi Abda, let me start that again. Myrna Abi Abdallah Dumet. Dr. Dumet has made outstanding contributions in shaping oncology nursing in Lebanon through her consistent efforts in scholarship and service. She also provides health promotion and disease prevention educational programs to the underprivileged Lebanese and Syrian refugee populations in both rural and urban communities. Welcome to the Academy. From the state of Louisiana, Sandra Brown. Dr. Brown has made significant contributions towards increasing the diversity of the advanced practice nursing workforce in Louisiana and in the nation. She is recognized nationally as a health information technology scholar and for her expertise in disaster nursing. Following Hurricane Katrina, she developed a model utilizing APRN students providing primary care in a FEMA trailer community. Welcome to the Academy. Gloria Jarrett. Dr. Jarrett's research documents the far-reaching impact of natural disasters, specifically Hurricane Katrina, on pregnant women and birth outcomes. Her work informed national perinatal emergency preparedness planners to prioritize mental health and social support interventions for pregnant women living in the post-disaster communities. Welcome to the Academy. Charmaine Lawson-Baker. Dr. Lawson-Baker is a practicing clinician, author, and entrepreneur. She has combined her expertise in business and healthcare management to influence several hundred clinicians across the U.S. to open house call practices in their geographic areas. She is also a best-selling children's book author. Welcome to the Academy.
From the state of Maryland, Andrea Broussard. Dr. Broussard is a policy expert particularly related to improving health care for all Americans by removing practice barriers for advanced practice registered nurses at the state and national level. Her work has significantly contributed to removal of practice barriers in 9 states so far. Welcome to the Academy. Teresa Brockie. Dr. Brockie combined her lived experience, tribal culture, and stories passed down from her mother and grandmother to inform her research among vulnerable Native American communities. She is particularly focused on community-based interventions for suicide, trauma, and adverse childhood experiences. Welcome to the Academy. Valerie T. Cotter. Dr. Cotter is an adult geriatric primary care nurse practitioner and academician who has combined her expertise in older adults and dementia to influence nurses and other health professionals in the U.S. and globally. Welcome to the Academy. Rita Dost. Rita Dost is an innovative leader who consistently leads the way in building and sustaining robust academic service partnerships that advance nursing education and interprofessional practice. Her research contributions improvise the health of veterans and elderly populations. Welcome to the Academy. Lynnette Hamlin. Lynnette Hamlin's expertise is in reducing health disparities and strengthening the healthcare workforce, including the integration of practice, health policy, and academic leadership. Welcome to the Academy. Shannon Idzik. Dr. Idzik is an academician and practicing clinician with a dedication to improving nurse practitioner practice, policy, and education. Her work includes serving on the Maryland Health Services Cost Review Commission, Physician Alignment, and Engagement Work Group. Welcome to the Academy. Yolanda Abulu. Dr. Abulu is a global health nurse leader, policy advocate, and neonatal nurse practitioner. She has leveraged her expertise in health equity, cultural competency, and policy to impact nursing and neonatal outcomes in the U.S. and globally. Welcome to the Academy. Michaela Olson. Michaela Olson is a leader in producing and disseminating evidence that demonstrates how to decrease central line-associated infections and strategies for safe handling of hazardous drugs. She has had numerous evidence-based initiatives that are now part of protocols and publications, which are used nationally and internationally to guide oncology nursing practice. Welcome to the Academy. Binsia Pandian. Dr. Pandian is an acute care nurse practitioner specializing in the management of patients with a tracheostomy. Her academic efforts have influenced the airway management and quality of life in mechanically ventilated patients. Welcome to the Academy. Susan Renda. Dr. Renda is a nurse practitioner whose work focuses on improving access to diabetes self-management education locally in primary care and specialty practices, as well as in global communities. Welcome to the Academy. Charlotte Siekman. Dr. Siekman's research and development of innovative technologies serve as a model to enhance patient safety and support clinical decision-making at the point of care, along with incorporated informatics principles into curriculum to prepare future nurse and leaders. Welcome to the Academy. Sherry Simone. Sherry Simone has worked at the national and international levels to establish competencies and guidelines for ill and injured children and served with the Pediatric Nursing Certification Board in the development of the Pediatric Acute Care Nurse Practitioner specialty. Welcome to the Academy. From the state of Massachusetts, Terry Aronowitz. Dr. Aronowitz's research focuses on advancing the science of sustainable, evidence-based care for sexual health promotion. Her research findings on rape myth acceptance influenced policy at Boston University to support the Sexual Assault Response and Prevention Center, providing 24-hour services. Welcome to the Academy. Marianne Didamasi. Dr. Didamasi has applied her expertise in systems dynamics to design innovative professional practice models that directly impact care delivery. She has developed, translated, evaluated, and disseminated knowledge that has elevated nursing practice throughout the world. Welcome to the Academy. Thank you so much. Maureen Fagan. Dr. Fagan's expertise focuses on patient engagement in research. Her patient family-centered care model creates and sustains authentic partnerships between patients, clinicians, and researchers. This model represents a paradigm shift that is the cornerstone of patient family-centered care. Welcome to the Academy. Jane Flanagan. Jane Flanagan is an academician, editor, nurse scientist, and nurse practitioner. Her work is grounded in the human health experience and focuses on strategies to promote healing in vulnerable populations. Welcome to the Academy. Welcome. Elizabeth P. Howard. Dr. Howard has improved the health of vulnerable populations through roles as researcher, practitioner, and educator. She has broadened knowledge of common geriatric syndromes and provided leadership to create and launch self-sustaining graduate programs educating scientists and advanced practitioners. Welcome to the Academy. Susan M. Lee. Dr. Lee is a senior scientist and palliative care nurse practitioner. Her work, Age-Wise, and the Lee Geriatric Caring Model has brought primary geriopalliative care to thousands of older persons experiencing frailty through the development of geriopalliative expertise among nurses. Welcome to the Academy. Cecilia McVeigh. Cecilia McVeigh created the Northwest Region VA Nursing Alliance, an innovative academic practice partnership with 6 schools of nursing and the Boston Bedford VA Medical Centers. Welcome to the Academy. Welcome. Patricia Meodanka Noga. Dr. Noga's leadership has created a viable, transparent, reliable source of data that engages patients, empowering them in their healthcare choices. She served as an expert resource to nurse leaders on how to understand, influence, and implement policy. Welcome to the Academy. Jannis Peleganis. Dr. Peleganis is a simulationist, academician, behavioral scientist, education innovator, and patient safety advocate. She has combined her expertise in healthcare simulation and interprofessional education toward collaborative learning through reflective and deliberate practice toward patient safety. Welcome to the Academy. Inez Tuck. Dr. Tuck's research is in the area of spiritual healing and relief of suffering and development of evidence-based holistic interventions to guide nursing practice. She acknowledges the impact of spirituality as a key component of the human experience. Welcome to the Academy.
From the state of Michigan, Patricia D. Hearn. Dr. Hearn's research characterized by the path biological mechanisms underlying sex differences in brain injury and outcome. Documenting the estrogenic influence on ischemia has led to a lineage of research wherein her name is now synonymous with the gender effect in stroke. Welcome to the Academy. Stephen Strobe. Dr. Strobe is Clinical Associate Professor at the University of Michigan and President of the International Nurses Society on Addictions. His position statements for professional nursing organizations have influenced practice and policy related to substance use and addictions nursing. Dr. Strobe is a Fulbright Scholar. Welcome to the Academy. From the state of Minnesota, Diane E. Holland. Dr. Holland is a nurse scientist at Mayo Clinic where she leads interdisciplinary efforts in transitional care and care coordination, including the development of adult and child versions of the early screen for discharge planning used nationally and internationally. Use of these screening tools has resulted in improved post-hospital outcomes for patients of the highest risk. Welcome to the Academy. Carolyn Marie Porta. Dr. Porta's research documents risk and protective factors experienced by vulnerable young people and tests interventions to improve their health and well-being. Her expertise in sexual violence prevention and response and global health is influencing multidisciplinary healthcare professionals worldwide. Welcome to the Academy. Martha Houston Turner. Dr. Turner is Associate Director of AAN's Center for Ethics. Her scholarship and leadership spans 5 decades and 5 continents. Recent work on the revised Code of Ethics guides all nurses and is foundational to theory, practice, and policy. She has provided ethics consultation to the U.S. Air Force Surgeon General on the ethical challenges of worldwide deployment. Welcome to the Academy. From the state of Nevada, Lisa Black Thomas. Dr. Black Thomas is a policy leader in the prevention of occupational bloodborne pathogen exposures. Dr. Black Thomas was one of the first registered nurses worldwide to speak publicly and advocate widely for safer needle alternatives in healthcare to protect frontline healthcare professionals. Welcome to the Academy. Katherine Ii Dingley. Dr. Dingley co-authored The Theory of Inner Strength in Women, contributing to strength-based interventions in cancer survivorship and other chronic conditions in the U.S. and globally. She's developed programs to improve safety and quality outcomes in hospitals for vulnerable, underserved populations. Welcome to the Academy. Rochelle A. Ekrus. Dr. Ekrus is an entrepreneur, organizational leader, and clinical forensic expert, serving underserved and never served populations affected by violence. She contributes regionally, nationally, and internationally to developing and implementing policies and best practice recommendations grounded by research, data, and ethics. She is CEO of the Center for Forensic Nursing Excellence International. Welcome to the Academy. Wei Chen Tong. Dr. Tong's research on HIV prevention behaviors and cervical cancer screening using the trans-theoretical model has addressed knowledge gaps and developed interventions to promote health in vulnerable populations. Her work influenced these practices in the U.S. and globally. Welcome to the Academy. From the state of New Jersey, Marion K. Novak. Dr. Novak is a practicing parish nurse, researcher, and educator. Her research addresses various public health issues with a focus on disaster nursing education. She's combined her expertise in public health and nursing to initiate programs nationally and globally. She is a United Nations nursing delegate. Welcome to the Academy. Elizabeth Scannell Desch. Dr. Scannell Desch's research has documented the experiences of military nurses in the Vietnam, Iraq, and Afghanistan wars and their reintegration after returning home. Her work has influenced how nurses are prepared for deployment and reintegration strategies after deployment. She previously served as Command Nurse Executive for Reserve Affairs at the Pentagon. Welcome to the Academy. Ellen Swartout. Dr. Swartout has extensive achievements in research, credentialing, measurement, strategic planning, professional practice program development, and implementation of leadership and critical care nursing. Her research focuses on evaluating care delivery processes and interventions that impact patient engagement and healthcare outcomes. She was the lead developer and investigator in the multi-site instrumentation study to create the Person Engagement Index tool that measures a person's capacity to engage in care. Welcome to the Academy.
From the state of New York, Judith Aponte. Dr. Aponte has served as a national advisor on diabetes health education and services tailored to the needs of the Hispanic population. Her research addresses culturally tailored interventions for Hispanic individuals with diabetes, including those who are only Spanish-speaking. Welcome to the Academy. Kenya Baird. Dr. Beard's research speaks to the significance of diversity and inclusion in nursing education and healthcare. Her multimedia scholarship spans print, online, video, and radio, and has been used to mitigate healthcare disparities. Welcome to the Academy. Amy Berman. Amy Berman is a leading voice for end-of-life issues and palliative care, and the development of evidence-based geriatric resources for nursing faculty, students, and practicing nurses. Using her expertise, she helped to change payment policy and for advanced care planning and to influence the national conversation on palliative care. Welcome to the Academy. Abraham Brody. Dr. Brody is a leader in geropalliative care and focuses on developing innovative home-based interventions for seriously ill older adults. His dementia symptom management intervention delivered by home health care quality of life for patients and caregivers nationwide. Welcome to the Academy. Mary Jean Nelson Busey. Dr. Busey is an international leading authority in management of multiple sclerosis in older adults. She combines education, research, and practice expertise to improve health care of this population and their caregivers. Welcome to the Academy. Elizabeth Gross Cohen. Dr. Cohen is a 2016 White House Champion of Change in Precision Medicine. Her career has been devoted to engaging communities in addressing the most pressing local, regional, and global health issues. Welcome to the Academy. Marilyn Hammer. Dr. Hammer's program of research investigates clinical and molecular mechanisms between glycemic status, immune function, and outcomes in patients with cancer. Her work influences glycemic protocols for patients undergoing treatment for cancer. Welcome to the Academy. Judy Honig. Dr. Honig is an educator, practicing clinician, and primary catalyst in the evolution of advanced practice and doctoral education, nationally and globally, and has been on the forefront of shaping the Doctor of Nursing Practice degree. Welcome to the Academy.
I have to thank you.
For me too. Diane LaPont Rohde. Dr. LaPont Rudo is a leader in educating, advocating, researching methods to improve care for the lives of organ donors. Welcome to the Academy. Marianne Marino. Dr. Marino leverages her pioneering work in forensic nursing and multidisciplinary teamwork to implement novel, nurse-led, team-based models that decrease disparities, improve access, and directly address determinants of health. Welcome to the Academy. Jean M. Moore. Dr. Moore is a nationally recognized leader in the field of health workforce research. Her work is used to inform planning and policy development aimed at assuring the availability of a health workforce equipped to address population health needs. Welcome to the Academy. LaRon E. Nelson. Dr. Nelson's research addresses HIV disparities by studying the implementation of multi-level interventions to reduce risk of infection and to optimize patient-centered treatment outcomes for people with HIV. He has led studies in the United States, Canada, and Ghana. Welcome to the Academy. Jamesetta Newland. Dr. Newland, through advocacy, education, direct practice, and editorial contributions, has been transformative in helping advanced practice nurses expand and thrive here in the US and globally. Welcome to the Academy. Oh, you get to take that with you. I'll take that. Deborah A. Rains. Dr. Rains is a leader in perinatal nursing in innovative educational programs. She studies questions that enhance patient well-being and workforce development and actively leads efforts to translate research findings into evidence-based practice. Welcome to the Academy.
From the state of North Carolina, Melissa Batchelor Murphy. Dr. Batchelor Murphy's work improves the nutritional status of nursing home residents with dementia through use of her innovative hand feeding techniques. Her work with traditional and social media brings nursing research and nurses' point of view to the public. She currently hosts a monthly broadcast TV show in the Washington, D.C. metropolitan area. Welcome to the Academy. Anna Song Bieber. Dr. Bieber is a recognized leader in gerontological nursing and is a health services researcher. She is devoted to improving the quality and safety of long-term care and enriching the quality of daily living for older adults residing in these settings. Dr. Bieber is passionate about inspiring the next generation of nurse and interprofessional scholars to provide innovative care for older adults. Welcome to the Academy. Beth Perry Black. Dr. Black's work addresses complexities of palliative care after severe fetal diagnosis and the challenges to LGBTQ persons in becoming parents. Senior editor of an award-winning text on perinatal and pediatric bereavement, she also authors a textbook on professional nursing issues. Welcome to the Academy. Jeannie DeGagne. Dr. Gagne is regarded as an inspiring educator, consistently role modeling commitment to the nursing profession. She is internationally known as an expert in online teaching and learning, dedicated to empowering nurses and creating a culture of nursing excellence. Her contemporary work on cyber civility provides essential evidence for schools around the world. Welcome to the Academy. Cheryl L. Giscombe. Dr. Giscombe is a psychiatric nurse practitioner and a social and health psychologist. Her groundbreaking biopsychosocial research and educational innovations have made major contributions to the development of culturally relevant interventions to promote mental and physical health equity for underserved populations. Welcome to the Academy. Sonia Renee Harden. Dr. Harden is known for work with the AACN Synergy model, cardiac surgery and care of older adults. She is a researcher in the design of cardiac devices, technology, and leads an interdisciplinary team on the HRSA-funded Geriatric Workforce Enhancement Program. Welcome to the Academy. Coretta Jenneret, sorry. Dr. Jenneret's research focuses on improving health outcomes for individuals with sickle cell disease and has had significant impact in the U.S., but also in other countries where thousands of children are born annually with the disease. She's received recognition from Nursing Outlook, the Southern Nursing Research Society, and participated in policy and research priority setting sponsored by NIH and other organizations. Welcome to the Academy. Donna Lake. Dr. Lake has led and documented innovative solutions in clinical operations, health policy, and academic curriculum redesign, enhancing nursing and other health professional faculty and students' development. She's combined her expertise in global health, health systems, and patient safety, which has influenced positive health outcomes at international, national, and local levels. Welcome to the Academy. Nancy M. Short. Dr. Short is a nationally known leader, author, editor, and educator in health policy. She's combined her public health background with policy experience to influence a U.S. Senate Majority Leader, national organizations, and a generation of Duke University's APRN students. She recently completed a term on the board of the National Association of Local Boards of Health. Welcome to the Academy. Catherine J. Trotter. Dr. Trotter is a practicing nurse midwife and family nurse practitioner, as well as an educator. She's combined her expertise in women's health and organizational change to facilitate implementation of centering, an evidence-based model of group healthcare throughout the U.S. Welcome to the Academy. Julie B. Waldrop. Dr. Waldrop has led the development of innovative practice and education models that support the full scope of nurse practitioner practice and advocates for rigorous outcomes for nurse practitioner education and practice, despite differing state scopes of practice. She is the associate editor of the Journal of Nurse Practitioners. Welcome to the Academy.
Our final 2017 honorary fellow is Dr. Jorge Tebow. Dr. Tebow has been the president of the Josiah Macy Jr. Foundation for more than a decade. He became president after a long career where he served as vice president of clinical affairs at Partners Healthcare System in Boston and the first Daniel D. Fetterman Professor of Medical Education at Harvard Medical School. Under his leadership, the Josiah Macy Jr. Foundation has had a tremendous impact on better aligning the education of health professionals with contemporary health needs and a changing healthcare system. He has created the Macy Faculty Scholars Program to develop the careers of innovators and leaders in nursing and medical education. Since 2011, 36 scholars have been named, and they are all assuming leadership roles locally and nationally while promoting educational change. He also organized 10 Macy conferences during his 10 years at the helm of the foundation in order for academic, educational, and health leaders to take on important policy issues. Those Macy conferences resulted in impactful recommendations, including those on elevating registered nurses' roles in primary care. As many of you know, our Academy and 15 Academy Fellows participated in a 2016 Macy conference on the role of RNs in primary care, and the Academy was successful in disseminating the results of the Macy recommendations through a series of regional critical conversations. Many consider Dr. Tebow to be the father of interprofessional education, and he certainly has been an innovative leader in promoting it and moving the needle from simply an idea worth exploring to real tangible support for institutions and individuals who are embracing interprofessional education. His actions were instrumental in the creation of the National Center in Interprofessional Education. Nursing has benefited immensely from Dr. George Tebow's leadership. The Macy Faculty Scholars Program includes nursing faculty. The planning committees for Macy conferences have had strong nursing voices, and his board of directors includes nurses. He has created positive change for everyone whose voice is critical to healthcare reform. We welcome George Tebow into the Academy as an honorary fellow. From the state of Ohio, Michelle Christina Ballas. Dr. Ballas's research focuses on developing, testing, and disseminating safe and effective interprofessional interventions aimed at reducing intensive care unit acquired delirium and weakness. She is internationally recognized for her work involving the ABCDF bundle, a coordinated multi-component evidence-based approach to managing critically ill adults. Welcome to the Academy. Lynn Gallagher-Ford. Dr. Gallagher-Ford's seminal contributions encompass forging national and international partnerships, conducting research, and educating clinicians to advance evidence-based practice and improve care outcomes. Welcome to the Academy. Scott A. Hutton. Dr. Hutton, the National Veterans Health Administration's nursing leader in workplace violence prevention, has augmented nursing service and enhanced workplace safety through creating and implementing an innovative evidence-based violence prevention model, which included tailored training, threat mitigation, consulting, and reporting. Welcome to the Academy. Janine Overcash. Dr. Overcash's research has focused on enhancing the care of the older person diagnosed with cancer. She is a nurse practitioner who has written extensively on the care of in an area of geriatric assessment in the outpatient oncology clinic. Welcome to the Academy. Melissa Ann Steck. Dr. Steck has combined her passion for student learning and expertise in technology to influence nursing education using innovative technology-centric teaching methods. She works nationally and internationally with faculty to improve how nurses are educated at every level. Welcome to the Academy.
From the state of Oregon, Jeffrey Solheim. Jeff Solheim is the founder of Project Helping Hands, a humanitarian nursing-based organization that provides medical care and education around the world. He is also a well-known nurse speaker, author, and mentor in emergency nursing. Welcome to the Academy. From the state of Pennsylvania, Joan Rosen Block. Dr. Block is a tireless advocate for advancing women's health nursing practice and science, a pioneer leader and educator in women's health nurse practitioner movement. Her current translational perinatal health disparities research illuminates unjust social and reproductive health inequities. Welcome to the Academy. Teresa M. Campo. Dr. Campo is an accomplished academician, practicing clinician, professional speaker, author, and editor. She was the first nurse appointed to the American College of Osteopathic Emergency Physician Board of Directors. Her work in expanding, educating, and supporting nursing roles have influenced emergency nurse practitioner practice nationally and globally through books, peer-reviewed articles, and presentations. Welcome to the Academy. Linda A. Hatfield. Dr. Hatfield's research investigates the analgesic properties of behavioral and environmental interventions, epigenetic modifications following noxious stimuli, and long-term effects of undermanaged pain in infants. Her work is critical evidence in national and international neonatal clinical practice pain guidelines. Welcome to the Academy. Lisa Kitko. Dr. Kitko's focus on palliative care needs of persons living with life-limiting illnesses and their families comprise her most significant contributions to nursing science and education. Her expertise is reshaping both palliative care clinical research and educational programs. Welcome to the Academy. Grant Martsoff. Dr. Martsoff is a nursing health services researcher and public policy scholar. His work brings the unique perspectives of nurses to bear on important state, regional, and national health policy issues, including scope of practice regulations, graduate nursing education, and the role of nurses in population health. Welcome to the Academy. Katherine Mcdonald. Dr. McDonald's research addresses risk and protective factors in adolescent injury. Her contributions include a web-based model of simulated driving performance for novice drivers that focused on adolescent driver inattention, as well as elucidating links between mental health and adolescent injury. Welcome to the Academy. Kimberly A. Montgomery. Dr. Montgomery is an administrator, educator, researcher, and nurse practitioner. A pioneer in exemplary interprofessional education models, she advocates for collaborative team-based care, champions nursing's role in healthcare, and positively impacts the quality and safety of women's health worldwide. Welcome to the Academy. Elizabeth A. Schlink. Dr. Schlink's research has advanced understanding of adherence to healthcare treatments and chronic care management for adults with rheumatic diseases. Through outstanding mentorship of DNP students, she has improved quality of care for several populations by implementation of evidence-based practice. These outcomes include hypothermia in premature infants, improving pain management in children, and improving HPV vaccine rates in adolescents. Welcome to the Academy. Mary K. Walton. Mary Walton, a clinical ethicist, has developed a model integrating ethics and interprofessional practice to ensure that patient and family voices are heard and honored in healthcare, contributing to the international culture shift toward person and family-centered care. Welcome to the Academy. From the People's Republic of China, Hong Li. Dr. Li serves as both hospital vice president and nursing school dean. In these roles, she has been dedicated to the promotion of professional nursing practice, innovation of hospital community health management model, policy making for nursing human resource allocation, international health promotion, as well as research on critical and aging care. Welcome to the Academy. From the Republic of China, Kui Min Chen. Professor Chen is a national and international leader in physical activity, intervention research, and their translations into practice to improve health of older adults. Through her appointments to several policy-making groups in Taiwan, she better advocates for care delivery for older populations. Welcome to the Academy. Kui Yun Wang. Dr. Wang is a nurse, leader, and scientist who has influenced the turnover rate of nursing and served as a strong advocate for improved nursing salaries and benefits and raising the voice of nursing in Taiwan. Welcome to the Academy.
From the state of Rhode Island, Jeanette Goslin First. Dr. First is an academician, researcher, and clinician. For the past 16 years, she has combined her expertise in psychiatric mental health nursing, neonatology, and correctional health to improve the standards of care for pregnant, incarcerated women and advocating for anti-shackling legislation across the country. She served as a Fulbright Senior Specialist in Sweden. Welcome to the Academy. From the state of South Dakota, Haifa Abu Samra. Dr. Samra's research and service address health disparities and urgent public health issues in neonatal, rural, and Native American populations. Her combined expertise in population health and quality and safety generated evidence supporting diverse policy and practice changes and identified factors that hinder delivery of services to remote communities. Welcome to the Academy. From the state of Tennessee, Tara Foster Akkard. Dr. Akkard's research on legacy interventions for children with life-threatening conditions and their families, multimedia recruitment methods, informing research methods for all ages and diseases. Welcome to the Academy. Welcome. Laura Humphrey Beebe. Dr. Beebe's research addresses interventions to foster community stability in persons with schizophrenic symptom disorders. Her work has transformed psychiatric nursing practice and shaped nursing education nationally and internationally. Welcome to the Academy. Welcome. Diane Todd Pace. Dr. Pace is an academician, clinician, and national advocate for provider-neutral language, the first nurse practitioner to serve as the president of the North American Menopause Society. Her interprofessional collaboration on menopausal education has prompted the best practice nationally and internationally. Welcome to the Academy. Welcome. From the state of Texas, Bob Dent. Dr. Dent is a hospital nurse executive and academician. He has combined his expertise in nursing and leadership to influence nurses, interprofessional colleagues, and healthcare leaders in the U.S. and globally related to culture, improving workplace environments, and nurse staffing. Welcome to the Academy. Anita G. Huft. Dr. Huft is a forensic psychiatric nurse and academician whose scholarship has focused on the care of women in correctional settings. Her leadership in professional organizations and academic nursing has significantly impacted the development of forensic nursing. Welcome to the Academy. Anne Christine Floyd Kose. Dr. Kose's scholarship focuses on marginality and health outcomes of women with a history of abuse. She has developed the Kose Marginality Index, the first measure of marginality which has been translated for use in international research. Welcome to the Academy. Nelda Martinez. Dr. Martinez's biobehavioral genetic environmental research in diabetes among Hispanic Americans is coupled with her service in establishing the national standards for diabetes education and guidelines for clinical practice. She has combined her research to support nursing education for minority students and trajectories in academe for minority faculty. Welcome to the Academy. Rebecca McCormick Boyle. Rear Admiral McCormick Boyle's diverse worldwide assignments from inpatient nursing to executive leadership readied her to contribute at the highest level of military medicine and professional nursing. Quality management, healthcare operations, executive medicine, education and training, and strategic planning are her areas of interest and expertise. Welcome to the Academy. Welcome. Stacy Mitchell. Dr. Mitchell is a practicing clinician and academician. She has combined her expertise in forensic health, criminal justice, and patient safety to influence nurses and other professionals throughout the United States. Welcome to the Academy. Welcome. Elder Ramirez. Dr. Ramirez is a professor, practicing clinician, and founder of the American Academy of Emergency Nurse Practitioners. Her research has supported the development of the role, scope, and standards, competencies for the certification exam and the emergency nurse practitioner. Welcome to the Academy. Jin Wong. Dr. Wang is advancing science for patient-engaged, mobile and connected health solutions to improve patient outcomes for those with chronic condition and aging in place. She is also leading a new interprofessional curriculum on mobile and connected health technologies. Welcome to the Academy. From the country of Thailand, Rucha Prupabol. Dr. Prupabol is a global leader in child, adolescent, and family health. Her global perspective and expertise in child and family community settings has impacted the practice of adolescent health promotion. Welcome to the Academy. Welcome.
From the state of Utah, Katherine A. Sward. Dr. Sward's research uses innovations in informatics and data science to bridge research and clinical care. Her work includes leading the Utah PRISMS Informatics Center, part of novel trans-NIH team science initiatives to study the effects of the environment on health. Welcome to the Academy. From the state of Virginia, Jan Torrance Balmer. Dr. Balmer's leadership has transformed the role of continuing education to incorporate interprofessional collaboration in learning, performance improvement for clinicians, healthcare teams, and organizations. She serves as a voice for nursing, leveraging continuing education to foster competence and collaboration. As chair of the ANCC Commission on Accreditation, she developed the Commission guidelines to develop accreditation standards for residency programs. Welcome to the Academy. Elizabeth Epstein. Dr. Epstein studies moral distress among healthcare providers. She introduced the model of the moral distress and moral residue crescendo effect. Her work on moral distress consultation has been successful in alleviating moral distress in difficult clinical situations. Welcome to the Academy. Donna Gage. Dr. Gage is a mediator, executive, and transformational leader widely recognized for working effectively with unions and interdisciplinary teams and empowering staff. While CNO of the nation's largest healthcare system, she transformed the advanced practice nurse role within the Veterans Health Administration. Welcome to the Academy. Jessica Gill. Dr. Gill is a tenure-track investigator at NIH in the Intramural Research Program. She has linked elevations of TAW to prolonged return to play in athletes and elevations to chronic neurological symptoms in veterans with brain injuries. Welcome to the Academy. Julie Tanner Sanford. Dr. Sanford is an academician and leads programs that remove barriers to quality nursing education for rural, diverse, and educationally disadvantaged students. A tireless advocate, she develops and implements innovative national and international initiatives to improve access to quality health care. In 2016, the White House recognized her as director of a school pledged to teach APRN students the CDC opioid prescription guidelines. Welcome to the Academy. Richard Westfall. Dr. Westfall is an advanced practice mental health nurse specializing in occupational stress and coping. He is a transformational leader whose research and professional practice guides organizations and their cultures to adopt functional approaches to assess and promote mental health. Welcome to the Academy. From the state of Washington, Deborah Ann Burton. Deborah Burton is Senior Vice President and Chief Nursing Officer for Providence St. Joseph Health, a 7-state health system with over 39,000 nurses. Her sustained contributions include strategic nursing workforce development, highly effective executive leadership, and advancing men in nursing. Welcome to the Academy. Kathleen Shannon Dorsey. Kathleen Shannon Dorsey's research has been centered in translational science and hematologic malignancies. She has led research in decision-making, including a study of the role of hope for patients participating in Phase 2 oncology clinical trials. Welcome to the Academy. Janet R. Katz. Dr. Janet Katz leads community-based participatory research and workforce development to reduce health inequities. The hallmark of her work is assisting communities to build protective factors and increase opportunities for education. Welcome to the Academy.
From the state of Wisconsin, Nancy Kaufman. Nancy Kaufman is a public health and philanthropy executive. Her tobacco research on industry marketing and policy work for increasing tobacco taxes contributed to reduced smoking in adolescents and adults, U.S. and globally, with 22 million deaths prevented since 2007. Welcome to the Academy.
So special.
Barbara King. Dr. King addresses older adult patient safety by optimizing quality of care delivery. She combines an expertise as an advanced practice nurse in geriatrics with research knowledge to design interventions to improve outcomes for patients, healthcare providers, and organizations. Welcome to the Academy. Stacy Larrett. Dr. Larrett's research addresses interventions to improve transitions of care for complex pediatric patients with chronic illness. Her combined expertise in clinical practice, education, and research have influenced nurses across the United States and globally. Welcome to the Academy. Polly Ryan. Dr. Ryan's research focuses on self-management and uniquely contributes to development of interventions designed to support engagement in the process of health behavior. She has led multidisciplinary teams, influencing future research and knowledge development, focusing on the process of self-management. Welcome to the Academy. Julia Sneathen. Dr. Sneathen's contributions to maternal-child health nursing have resulted in the creation of innovative and sustainable service models with demonstrable achievements in clinical practice, policy, and research programs in emerging countries to improve the care of women, infants, and children. Welcome to the Academy. Ladies and gentlemen, it is an honor to present the 2016 Fellows of the American Academy of Nursing. So this has been a wonderful celebration of our colleagues' accomplishments, but the night is not over yet. The party is about to begin. So to continue the celebration, there are several receptions being hosted throughout the hotel. There's food, drinks in the foyer right outside the ballroom and in the mezzanine foyer above the lobby level. So please return here within an hour where this room will be transformed for our dessert reception soiree, complete with an extraordinary dance band. So please exit the room at this time. Return here in 1 hour to continue the celebration.